There is a new COVID-19 variant that is making the rounds. Beth Galvin has more on what you need to know to stay safe.
The only way to really know for sure if it's COVID-19 or something else is to take an at-home test, or you could go to the doctor's office and take a more exact PCR test. And as we're headed out of the holidays, we're likely to see a pretty big jump in people who are testing positive.
As the holiday travel season winds down and people head back to work and school, COVID-19 infections continue to rise. As of December 23rd, the latest CDC estimate, just over 29,000 Americans were hospitalized with COVID-19, with infants and adults over 75 hit the hardest. Dr. Felipe Lobello is a physician and epidemiologist with Kaiser Permanente, Georgia.
We're right on that border of things starting to become stretched in the healthcare systems. All the healthcare systems are thinking right now, do we need to bring back masks, for example, for our physicians and our healthcare providers to protect themselves and also to protect others.
And a new highly contagious COVID-19 variant, JN.1, is driving about 44% of U.S. cases. The CDC says it's not more severe than other circulating strains, and the symptoms have stayed pretty consistent. You may experience fever or chills, cough, shortness of breath or difficulty breathing, fatigue, and muscle or body aches. Other symptoms, headache, new loss of taste or smell, sore throat, congestion, or runny nose. And some people also have nausea or vomiting and diarrhea. But the only way to know if it's COVID is to get tested.
With testing, we can sort of pinpoint the right treatment if it's necessary for particular individuals that may need it. And you want to start that as early as possible.
The CDC is urging Americans 6 months and older to get an updated 2023-24 COVID-19 vaccine, but only about 18% of U.S. adults and 38% of seniors 75 and older have gotten the shot. Dr. Lobello says many of us already have some level of immunity against this virus, either from prior infections or vaccinations, but that immunity wanes with time.
Really, after 4, 5, 6 months, your levels of protection start to drop off.
So Lobello says if it's been a couple of months since you've had COVID-19 or you haven't gotten that updated shot,
you haven't had something in the last 6 months, I would strongly recommend it because the activity just keeps increasing.
And if you do test positive in the weeks to come, the CDC recommends isolating at home, staying away from others for at least 5 days. And if you're at higher risk of getting severely ill from COVID-19, you may want to talk to your doctor about taking an antiviral medication, but you need to do that within 5 days of developing symptoms. For your Fox Medical team, I'm Beth Galvin.